sweet.
Hey, they're always nice to have them know if they're paying them.
All right, well, if you don't like them, you just delete it.
Right,
All right.
exactly.
Final thoughts, and we already mentioned this, you do not need 5 out of 5 strength proximally before you attempt to go get a muscle distally that's weak, okay? I think you understood that one.
Is there a baseline?
I was
That you
just about
should
to ask
move
that.
on? Like
Well, let me tell you
3 lines
this,
and
if
you can move
you're
on?
a 0, and a 0, I work up high. But if you're like 3, 2, 0, you know, it's very, I guess, subjective as far, there's no like grading scale that you say, well, when you're here, you go here. But just think, like, if you're 0 at the hip and knee, crap, put a brace on the foot for now, let's see if we can get the hip and knee going. Let's use our facilitatory techniques for your hip and knee muscles. I'd probably start at the hip.
So you just kind of judge it for each patient?
Yeah, but you'll kind of know where to go. Just understand you don't have to be perfect one place to address another, but you have to be, I would say, functional at one place before you address the other. That's probably a good way to put it. All right,
I knew you were watching me.
we sort of mentioned this, but I would always strengthen the other limb as well. So whatever their sound extremity is, you want to do your exercises to that sound extremity. Even if that extremity is 5 out of 5, when you work the sound limb, you may get carryover flow to the involved limb. So you're always doing both. When you show the motions with your rhythmic initiation, show the sound limb so the sound limb can feel it. Like when I'm teaching quad sets to my total knee patients, I do the quad set on the sound limb. All right, you feel that muscle tightening? Yeah, that's what I want on this side. Okay. Which kind of segues me. These techniques that we just used, these aren't just for neuro patients. You'll use them for your total knees, for your ACLs, for your super high level athletes. Like, I took my kid for a running assessment, and the therapist is teaching him specific exercises for running. But all he was doing when he was doing the exercise, like, yeah, no, move this way, no, we want to be here. So he was passively putting my kid in positions to perform the exercise. Now, the difference is my kid, once he feels it once, that's it, hands off. Your patients, your neuro patients without strength or sensation just may need you there longer and more. Well, they will, actually. But these techniques, the tapping, so like if my kid started rotating one way, he's like, come over this way. So the therapist in orthopedic outpatient used tapping, rhythmic initiation. He didn't use vibration or quick ice, or quick stretch for that matter, because he didn't need them. The tapping and the rhythmic initiation were enough. He didn't need E-stim because the strength was pretty good.
What was the injury again?
There's no injury. Actually, that's what I'm getting at. All he was doing was teaching exercises. So if you're going to teach an exercise, rhythmic initiation and tapping are 2 good ways to get your patient to do what you want them to. So there wasn't even an injury involved. But orthopedic outpatient, guys, is neuro. It's all neuro. On the practical, I do not, and I repeat, do not want these as standalone treatments. So, right?
I was about to
Sorry,
ask you
man.
that.
So I don't want to say, all right, here's one treatment. All right, we're good here, let's move on. Now, I do want to see these thoughts placed into a treatment. So kind of like what, the perfect example would be, we did high kneeling with V to try and facilitate anterior tib by giving him perturbations while tapping. Beautiful. You did tapping, you had a great posture, but you had a different intervention. You know, the intervention wasn't just, okay, that wasn't the star of the show, that was just a piece of the show. All right? So all these things here are just a piece of the show. Even E-stim. If you're gonna use E-stim, great. Use it don't just put E-stim pads on a patient and do E-stim. I wanna see more. That's that.